One thing most Americans can agree on is that our healthcare system is in critical condition. An estimated 47 million Americans have no health insurance, and 8 of 10 of those without insurance are in families in which someone works full-time. Those uninsured often delay or forego needed medical care. As a result, millions grow sicker and die earlier than those who have insurance.
Just wait until something awful happens, until they get hit by a car, or until they're, yeah. And then what? And then you go to the hospital and you get these crazy bills, and next thing you know, you're in debt.
Meanwhile, an estimated 77 million Americans are underinsured. Although they have health insurance, their policies are inadequate, leaving them exposed to hefty medical bills that they have trouble paying. All told, the U.S. spends more than 50% per person more on health care than other comparable countries, but often lags behind in providing timely and effective health care to its citizens. How did we get to this point? In most developed countries, such as Canada and Germany, health care is considered a fundamental right. In the U.S., government programs such as Medicare and Medicaid cover millions of the elderly, poor, and disabled. Most other Americans still are covered by private, employer-based health insurance, but that coverage is eroding. The root of the problem: rising costs for health care and health insurance.
We're seeing a lot more families and a lot of working people who either don't get insurance through their employer, or the employer offers insurance, but it's too much of their salary or too much of their paycheck for them to be able to afford it.
An estimated 60% of businesses now offer coverage to their workers. That's down from 69% in 2000. Meanwhile, rising Medicare and Medicaid spending poses a major challenge to the nation's fiscal future. There's nothing in our Constitution that guarantees a right to health care. But should everyone be entitled to health care, just as we provide every child an education?
How many teeth does she have? 6.
Some people believe health care is a vital human need and that government should play a role in making it available to all.
Well, how are things going for you?
Pretty well. On the other side are those who consider health care more of a market good. They say government has no special responsibility to assure access to care, and that individuals should consume health care based on their personal preferences and ability to pay. For decades, federal health reform efforts have sputtered. Meanwhile, some states, such as Massachusetts, have enacted their own reforms. But the Massachusetts plan faces cost overruns and tens of thousands who still are without coverage. All 3 presidential candidates have offered health care plans. But to decide how to reform the health care system, voters must ask themselves the questions central to tonight's debate. Do Americans have a fundamental right to health care, and does the government have the obligation to secure that right?